An evaluation of the effect of equine-facilitated psychotherapy on patients with substance use disorders. This was published online in 2023, June 28th, in the National Library of Medicine, National Institute of Health. Carmen Concerto is the editor. Abstract. Equine-Facilitated Psychiatry and Psychology, that's EFPP, is a supported non-pharmacological treatment program used in the treatment of patients with substance use disorder. The aim of this study was to evaluate a possible change in patients' health and health-related quality of life between the first and fourth session of the EFPP program, using the Assessment of Quality of Life, AQOL, and the Health of the Nation Outcomes Scales, HONOS. The Human-Animal Interaction Scale, HAIS, and a 5-point Likert type scale was used for an assessment of patients' mood in the experimental group. The study sample included 57 patients, 39 in experimental group with the Equine-Facilitated Psychiatry and Psychology, and 18 without the EFPP program, with substance use disorders hospitalized in a psychiatric hospital. Comparing the initial and final patient scores in the experimental group, there was a significant positive shift in the 3 or 4 domains of the HONOS scale and in 7 of the 8 dimensions of the AQOL scale. HAIS significantly increased in time as well as patients' mood after every session and in long-term perspective. Based on these results, we can assume that the Equine-Facilitated Psychiatry and Psychology might be one of the successful programs which may improve patients' mood and social interactions in substance use disorders. Background. Equine-Facilitated Psychiatry and Psychology as a form of animal-assisted therapy, AAT, engages horses in and around the natural surroundings of the stables to support clients' development of positive behavioral and emotional wellness. EFPP has shown efficacy for building self-esteem, attachment, and trust in both the horse and the therapist. EFPP is one of the possible supportive, non-pharmacological approaches in the treatment of substance use disorders. Substance use disorders are serious and chronically recurrent disorders in which the affected individual has difficulty restricting drug use, has strong motivation to use the drug, continues to use it despite the negative consequences, and experiences negative emotional and physiological states when discontinuing or decreasing the intake of the drug. Substance use can also lead to disruption of family and social relationships and a significant change in the individual's morals. For all treatment approaches, it's essential to confront the patient with reality and break the denial, which is reinforced by the positive effects of the addictive substances. A comprehensive approach is used in the treatment of addiction in a combination of non-pharmacotherapeutic and pharmacotherapeutic procedures. In a therapeutic environment, horses are perceived as non-judgmental beings, which makes it easier for clients to connect with them and communicate. Successful communication influences the building of the client's self-confidence. Other important effects include a sense of accomplishment from correctly performing a task, and the eventual overcoming of the initial concerns associated with working with horses. During EFPP, clients mentioned similar feelings as when under the influence of drugs. It was mainly a feeling of happiness, isolation from the outside world, and forgetting about negative things and worries. These effects could be caused by concentrating hard on the present moment, on the activity that the client is performing with the horse at a given time in a given place. In addition to horses, the place where EFPP takes place also affects clients. The environment of the farm, the fresh air, and the momentary departure from the ward, together with the shared group experience, are among the important factors which, combined with the EFPP itself, form a comprehensive rehabilitation approach. The therapeutic benefit as a whole is then based on a combination of all activities, impressions, and emotions that are related to horses or their environment. In summary, EFPP includes healthy physical exercise, mental relaxation, self-reflection, enjoyment, and learning new skills. All these factors of therapy contribute to successful treatment. Moreover, motivation, willingness to cooperate, and a positive attitude are the cornerstones for the persistence and effectiveness of institutional treatment for addiction. The presence of horses and the stay in their environment increase the willingness of clients with addiction to remain in treatment programs and improve the motivation to participate in other treatment activities. The aim of this study was to evaluate a possible change in patients' health and health-related quality of life between the first and fourth session of the EFPP program, using the assessment of quality of life, the Health of the Nation Outcome Scales, the Human-Animal Interaction Scale, and a 5-point Likert type scale for an assessment of patients' mood in the experimental group. All domains are expected to improve in patients of the experimental group compared to the control group. In patient-horse interaction, we expect more desirable and less undesirable behavior in both humans and horses.